Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine again. Welcome to our video series for parents. Remember, these videos are intended to help you to understand what's going on with your child, but they're not intended to replace visits to the pediatrician. So if you have concerns, please make an appointment to see your doctor. We're happy to see you here in our office, area code 775-359-7111. Today we want to talk about thrush. Thrush is a very common event for young children, infants. It is a fungal infection of the mouth and often shows up as white spots on the tongue, in the cheeks, on the inner lips. Excuse me. Thrush is not dangerous, but it can be very painful, and it definitely can make it difficult for the child to eat. If the child is nursing or bottle feeding, can make it difficult or impossible for them to feed. So, how do we diagnose this? Well, if you look in the mouth, it looks a lot like there's milk in the mouth, but it's stuck. It won't disappear. It won't rub off with a gauze. Won't rub off with your fingertip. So if you look and you think there's milk stuck in your baby's mouth on the baby's cheeks and it wipes off, that probably was milk and nothing to worry about. But if it doesn't wipe off, we need to see you because we can treat it. What causes this? It's usually caused by a germ called Candida albicans. This is the same yeast germ that causes yeast infections for women. Unlike adult women, who usually have to have a history of antibiotic exposure or some kind of problem to get yeast infections, infants just get this in the mouth. It just happens. For those babies who get it, most babies get it once. For those who get it, maybe 2% get it repeatedly during the first year of life. And why that 2% keep getting it over and over again, nobody seems to really know. But we do know that there's a handful of kids who get it over and over again. There's really not any good over-the-counter treatment for this, but there is a lot we can do here in the office. So if you think your child's got this, by all means come in and see us. It's easy to fix. If you are nursing and your baby has this, it's probably a good idea to get an over-the-counter yeast cream like gyne-lotrimin or Monistat and massage that into your nipples, because the baby will transfer this same fungus to your breasts and will keep reinfecting himself. More importantly, this will make your nipples raw and make you start bleeding, and you don't want that. So you can apply that to your nipples every time you give the medicine to the baby in the mouth. Usually we treat the baby in the mouth about 4 times a day. If the baby has a pacifier or is bottle fed, we also recommend running everything through the top rack of the dishwasher a couple of times to just kill the fungus off, so that you don't keep reinfecting yourself. If you don't respond, usually we use topical medicine for the babies. If they don't respond to this, then there are some things we can give that they swallow to use to treat this. I don't recommend over-the-counter medications for this. There's an over-the-counter herbal that people use called gentian violet, and gentian violet's safe to apply to the skin, but I would not apply to the mouth. It's dissolved inside of a specific type of alcohol that's kind of dangerous for kids. Actually, it's dangerous for adults too, so it's not really intended to be taken orally and probably shouldn't be used orally. So I hope this helps, and I hope it helps to demystify this. If this is happening to your infant, don't be too freaked out. Your baby's not going to die from this, but they can be made miserable. We can certainly make it better very quickly. And the medication, besides curing the infection, is very soothing to the infection. So if we can be of help, give us a call here at area code 775-359-7111. And again, check us out on Facebook, www.sparkspeds.com. I'm sorry, www.facebook.com/sparkspeds.nv. Have a good day.